Ever wondered who's behind the remarkable healthcare transformations in Nova Scotia? Let's find out. Welcome to Voices of Nova Scotia. Today, we're shining a spotlight on the incredible Nigerian healthcare professionals making waves in our community. From doctors to nurses, these heroes are not just saving lives, they're enriching Nova Scotia with their dedication and heart. Their journey from Nigeria to Nova Scotia is nothing short of inspiring. Whose compassion knows no bounds, making every patient feel like family. These stories are a testament to the power of resilience and the impact of community. Through their work, we're reminded that healthcare is not just about treatment, but about connection and care. Thank you to all our listeners for joining us in celebrating these incredible individuals. Stay inspired, stay connected, and don't forget to always tune in for more heartwarming stories. Together, let's keep honoring our healthcare heroes. Thank you once again for joining us today on Voices of Nova Scotia.
Hello and welcome to another episode of the Voices of Nova Scotia podcast. We're excited to have you here today. Can you introduce yourself?
My name is Madusha. I'm a licensed practical nurse here in Nova Scotia. Work specifically postpartum, and I've been here in Nova Scotia for 8 years now.
Can you tell us what inspired you to pursue a career in healthcare?
So what inspired me with healthcare is I previously worked in healthcare. When I first came to Nova Scotia, I started working, with physician's office, doing more administrative work. But then as I got to, interact with the patient, I, kind of wanted to do more. So be more involved in hands-on patient care. And I have some other personal experiences that I have, which I necessarily want to share, that inspired me to pursue healthcare. So basically wanting to do more for the patient. So I'd already worked in healthcare, but in a different capacity. So I wanted to be more hands-on with patient care. So that's why I pursued nursing.
What motivated you to move to Nova Scotia?
So when we were going through the motions and trying to go through the express entry, Nova Scotia stood out to us more because it was more family friendly. So just from research and looking at two provinces. So two provinces we had in mind was Ontario and then Nova Scotia. But we loved that the province was more family oriented. It was kind of more of a slow pace, especially moving from Lagos. We didn't want to move from one Lagos to another kind of Lagos like city. So Nova Scotia was the ideal place. We love the ocean. There's so many lakes here and ocean front. So those are some of the things that made us move here.
Can you describe what your experience has been working with the Nova Scotia healthcare system?
So as a nurse in working on the units, one thing that I've seen is I'd say generally most of your co-workers, they're very supportive, wanting to see you grow and helpful. The only experience I'd say would be more diverse workforce would be ideal, because when you go into the workplace, you want to see other people that look like you and not just be the only one. But for the most part, it's been great. I have amazing co-workers, and we have resource people around who are always ready and willing to help.
Can you tell us what you like about Nova Scotia and its healthcare system?
So what I like about it, it's evolving. If we look at 8 years ago, we're not the same place we are now. I think there's more diversity, there's more diverse workforce, and that I can applaud the government's efforts so far to bringing in new healthcare professionals. So diversifying, I like that the workforce is beginning to get diversified. It wasn't like that before, but we're gradually seeing that change. In terms of the work itself, there's the collaborative piece of it. So you're not just working alone. So you have other members of the healthcare team working hand in hand. So there's more of a patient-centered approach and intercollaborative healthcare approach to healthcare here in the province. So that's a big piece of it that I like.
What challenges did you face when you arrived in Nova Scotia and in your practice with the healthcare system?
So challenges will be, one of the biggest things will be language and culture cultural shock. So it's very different, like coming from Nigeria. Communication is one thing, especially you're caring for patients who are mostly Canadians, and the way they communicate is very different. The language is different, so you need to understand how they communicated. So both verbal, non-verbal communication. So that was a big challenge. There's a lot of small talk that happens here. When you're interacting with your patients, you need to learn how Canadians interact. So that was a big thing. So I think the communication piece was a big challenge, not necessarily the skills or hands-on part of it.
How has living in Nova Scotia changed your perspective on life and your career?
Nova Scotia is more of a how do I put it? So it's more slow paced compared to, I've visited Ontario and all the other provinces, and here it's more like you're relaxed. So it's a more relaxing place to live in general. So you can achieve what you need to achieve. You're not running a rat race. In the morning you're not sitting 2-3 hours in traffic just to get to work, so that's more time for yourself and more time for your family. So just that, moving away from that hustle and bustle of, I say, Lagos life where I was living, to here, it's kind of more it's more calming.
And how did you respond to those challenges?
So most of it was more of like learning. So I took a communications course just before, like during my nursing program, and just before I started nursing, I took a communications course, which was, I say, it made a big difference. So I think if I were to advise any healthcare person coming here, I'd say a communications course will be very beneficial. I found it improved my interaction with patients and even people around me.
What can the government of Nova Scotia do to attract and retain more healthcare professionals?
I'd say for me, like just my own personal perspective, I think streamlining the process for accreditation. So people coming in for licensing, when they come over, it's such a long. I know that they have. A lot has gone in. A lot of the work has gone in, because I know it. Like previously, used to take some people, take them 3-4 years even to get all that process, and it has been streamlined. Like these people are getting licensed now within a year, within 2 years. So I think a sort of a training program will be beneficial. If people are coming in, they know that when they come into the province, they're able to get hands-on experience. So it's kind of like a mentorship program. If that can be set up for nurses, for doctors, it would be good. So when they come in, while they're working towards their licensing, they're getting hands-on experience with healthcare professionals who already work here. I think it would give those healthcare workers a sense of belonging. When they come in, they know that they're not alone. They know that they have the support that they need. So streamlining that process would be beneficial. The other thing they can do is the pay. And like, I know that across the province, if you want more people across the provinces in Canada, I think if Nova Scotia will have an edge with a more competitive pay package overall. Because as much as people want to come in, they're coming in as immigrants. It's a lot of settlements in place. They need housing, they need groceries. So all of this costs money, and most people will move, especially for immigrants, the economic immigrants, they're moving to get better opportunities. So competitive salary or competitive compensation package would be good.
Has the Nigerian community supported you? If so, in what ways have they supported you?
So, like with the Nigerian community, especially the Association of Nigerians in Nova Scotia, they put in a lot of projects geared towards healthcare workers. So we've had like seminars. There have been seminars just for healthcare workers, especially targeted to immigrants. Also, like in previous years, we have, and even now, there has been projects on recruitment and retention. So basically, there's a research piece that went out, which I happen to be a part of. So, just getting that perspective of different healthcare workers. What are the challenges that they have? So collectively, not just one person saying it now. So those projects I find are helpful because what it does is that it amplifies the voice of the Nigerian healthcare worker here in Nova Scotia. So it's not just one person speaking. The government can recognize that there is an organization that supports these immigrants, that supports these Nigerians who are coming into the workspace.
Thank you for joining us today. We hope to see you again in the next episode. Bye.
I'm sure it has been great exploring the journey of our healthcare heroes. Voices of Nova Scotia will be back with another episode. Stay tuned for more captivating stories. Whether you've tuned in from Halifax, Truro, Sydney, or halfway across the world, it was great connecting with you again to explore the great journey and stories of Nigerian healthcare professionals on Voices of Nova Scotia, where we celebrate our healthcare heroes. Thanks for joining us, and we look forward to seeing you again. Take care for now.